Good evening. Your Excellencies, Deputy Secretary General of the United Nations, distinguished delegates, ladies and gentlemen, thank you for being here today for the opening of the art exhibition, Mental Health in Crisis, Surviving and Thriving, co-sponsored by the Permanent Missions of Qatar in Nigeria and organized in collaboration with UNFPA and NEM Foundation. Mental health is becoming a defining issue of our time. Mental health disorders are recognized as a global challenge. In many parts of the world, individuals with mental health challenges often have to struggle to not only struggle with the symptoms, but they also struggle to exist and function amidst prejudice, discrimination, and stigma. Therefore, we must continue to build awareness, share knowledge, and encourage governments to build healthcare systems that support mental health and well-being. It is in this light that the government of Qatar and Nigeria, working together with UNFPA and NEM Foundation, decided to host this art exhibition and awareness talk on the issue of mental health. We have a fun evening for you this evening. We will feature paintings and photographs illustrating the mental health issues in conflict and fragile settings. We will also have a dynamic conversation on the broader issue later this evening. To get us started, it is now my distinct honor to give the floor for introductory remarks to our co-sponsor for this event, Her Excellency Ms. Aliyah Ahmed bin Saif Al Thani, Permanent Representative of the State of Qatar. Your Excellency, you have the floor.
Thank you so much. Good evening, everyone. My dear sister Amina Mohammed, Deputy Secretary General, Excellencies, ladies and gentlemen, good evening. I'm so delighted, of course, to co-host tonight's exhibition on this very timely issue on mental health with my dear brother, the Ambassador of Nigeria, UNFPA, and the NEM Foundation from Nigeria. I very hope this exhibition, of course, will become an annual series aiming at raising public awareness and fighting negative stereotypes. I am also very grateful to, again, my dear sister, Deputy Secretary General Amina Mohammed, for her genuine interest and commitment to bringing this issue up front. Thank you so much for reaching out. Thank you so much for inspiring all of us. This is just one topic of many, many initiatives and many areas of interest that you bring to the attention here at UNNY. Qatar has been very committed to improving mental health services, both nationally and globally. For instance, on December 8th of 2018, we will be hosting the Qatari International Mental Health Conference, a leading conference in the Arab world. This is the 7th time that the Hamad Medical Cooperation in Doha will dedicate resources and organize this event to promote learning and the exchange of international best practices and knowledge among healthcare professionals, and also to promote much-needed innovation. Another interesting work is being undertaken also by the World Innovation Summit for Health, known as WISH in Qatar, an initiative by the Qatari Foundation, which has dedicated substantial resources to mental health issues. WISH has developed an initiative with the Carter Center to improve media reporting on mental health issues. The promise of this initiative is that informed and accurate media reporting can play a huge role in the dissemination of accurate information and in shaping the attitude of the general public towards people dealing with mental health issues. This is one of many initiatives. But again, to conclude, of course, and before I give the floor to the next speaker, let me highlight that we are very much and extremely proud that mental health issues often feature in our development cooperation and humanitarian work in Qatar. And I very much, again, give all the gratitude to Deputy Secretary General Amina Mohammed for initiating this amazing idea. I hope you enjoy the evening, and I hope you, together with us, raise awareness with this very important cause by walking through our exhibition, our art exhibition. I thank you again. Thank you so much.
Thank you, Excellency, for your opening remarks. It is now my distinct honor to give the floor for opening remarks to our other co-sponsor of this event, His Excellency Mr. Tihani Muhammad Bande, Permanent Representative of Nigeria. Your Excellency, you have the floor.
Let me, on behalf of the nation of Nigeria, thank the DFG and Your Excellencies and colleagues, and in particular, my sister, the permanent representative of the State of Qatar, for inviting me to be part of this very important event. It is an important event because of all the goals of the SDGs and the issue of leaving no one behind. The one issue that is completely ignored, because those affected hardly know what the conversation is about, is that of mental health. Indeed, countries, be they developing or developed, hardly make this an important matter. Not only is it a stigma in the developing world, it is also a stigma in this country and in all other parts of the world. Now, there are differential capacities around the globe to handle, even when you wish to, even if there is political will to handle those in need of mental care. Some countries are better able because of better facilities and better training than others. I know in Nigeria, with about 200 million people, we are battling to deal with a lot of challenges, including disparity in healthcare, health provision. And of this, the number of professionals able to deal with health matters is the smallest, because very few are able, because it takes a lot of time and effort, and hardly do get support, either through private organs or through ministries. The federal government, because we are a federation, has a bill which seeks to address this as a concern. This fits directly into our commitment as a country to deal with, to address issues as articulated in our development goals. Let me state that even with the best intention, there is need for sharing information and knowledge. There's need for giving support to training institutions, and also provision of facilities. This is something that global efforts need to be strengthened. At this level is critical, but also regional efforts. I should like to say that I'm not being asked here to come and give a long speech. All I wanted to do was to indicate that even with the challenges, the effort is very strong in the country, and there are private organizations that have started to talk about this beyond the traditional healers who, in certain settings, take the space because that is the only thing available. And I should like to conclude by once again thanking you, and also stating that we'll continue to work on this matter with you and all other partners. And I would like to also be part of you to enjoy the exhibition. Thank you very much.
Thank you very much, Your Excellency. I'm now delighted to welcome our next speaker, Ms. Laura London, Deputy Executive Director of UNFPA. ASG, the floor is yours.
Thank you. Thank you, and good evening, Excellencies, ladies and gentlemen, colleagues. UNFPA is very pleased to be co-sponsoring this exhibition on mental health in crisis, together with the missions of Qatar and Nigeria and the Neem Foundation. We appreciate very much the support of the Office of the Secretary General in this regard. Ladies and gentlemen, every minute 20 people are displaced from their homes by conflict, disaster, and persecution. Today, there are more refugees and displaced persons in the world since the Second World War. From Yemen to Syria to South Sudan to Northeast Nigeria, the levels of violence, including sexual violence, are taking a deep and terrible toll. It's easy to see damage to buildings, to roads and bridges, but we are here tonight to talk about the damage inside a human being. Violence and trauma can harm mental health This, indeed, as was said before, is a defining feature of our time. Worldwide, the incidence of depression and anxiety are rising. The paintings of this exhibition, Mental Health in Crisis, express the feelings of trauma, of sadness, grief, and fear. Fear of another attack, fear of never feeling safe again or better, or fear of sleeping at night. UNFPA is working to promote mental health through psychosocial support, referrals to psychiatrists, and home visits by psychologists, especially to women and girls subjected to gender-based violence. We are working to promote health, safety, and dignity. This is why we are establishing safe spaces for women, for young people, and for refugees and displaced people. In 2017, UNFPA supported 725 spaces in 50 countries. In these safe spaces, women get counseling and other services to aid rehabilitation and recovery. They report feeling safe. We are committed to promoting mental health and psychosocial support and to ending stigma and discrimination of those who suffer. I thank you.
Thank you, ASD. So we now have an incredible treat for you. We will take a short video of the work of UNFPA in Nigeria supporting Chibok girls.
Lokacin da abu ya faru da ni, ina wajen babana. Na zo wajen mamata, shine suka fara nema na suna sona. Ni ban yadda ba in ji mamata in ba zan yi aure ba za ta tsine ni. Shine ta zo ta tsani na yi aure. Ina zaune haka. Ranar sai ya zai ce mu zai kai ni gun 'yan uwan shi. Da ya fitar da ni, ashe shi nan zai kai ni cikin jeji.
Yanda muka yi dai muka gudu zuwa nan, mu da mutane na sun zo su shiga cikin micika, mun taka da kafa, wayansu sun hau moto da fari, mu kuma da shike mu bamu da abun hawa, mu bi jeji har muka iso.
Mun tashi da kafa muke ta tafiya, mun kwana a hanya, sai can mun zo Uba da kafa, sai mun zo na can kenan. Sai sanan mun sake wuce wani kauyen su mai gida na kenan, mun sana mun je mu yi kwanaki a can, haka din kuma sun sake shiga sun bi mu zuwa can, tashiwar mu kenan sai mun zo nan.
Some of the experiences they share with us includes their trauma. You know, life in the camp is not easy for them. Leaving your home and all that, we can all imagine. They came in here, even though they were given food, shelter, and other basic needs. You know, I can say all of them are traumatized. We can all imagine what they have been through up to the level they are in the camp.
These safe spaces were created or established for the benefit of survivors of gender-based violence. And they use this space for different things, and the women are so happy to be in this because this is their own territory. They can talk women's issues, they can ask questions, they can, they get education about GBV, how do they prevent GBV. It prepares them for the reintegration when they go back into the community.
What important work. Thank you very much, UNFPA. Our next speaker is the United Nations Deputy Secretary General, Ms. Amina Mohammed. Please join me in welcoming her to deliver a keynote address.
Thank you very much. Well, first of all, this is an incredible pleasure to be here with all of you, and really deep appreciation to my sister, the permanent representative of the State of Qatar, and of course my brother from the permanent mission of Nigeria. UNFPA has been doing amazing work in Nigeria and many other countries, so thank you for bringing all of this to the spotlight, because that's really what we want to see. This is something that when I first joined the United Nations and I was asking the Secretary General what are the things that he really wants to focus on, and one of the first things he talked about was mental health, his own personal experience, and those who helped in his family, his work as the Prime Minister. And so today, just having an organization that works at the grassroots, Neem Foundation, with us and sharing some of their experiences, building on what we've done over the last 2 weeks, which is to launch our strategy to bring mental health really into the fore, that it becomes something that is not in the shadows anymore or behind the screens and faces of people who smile but yet are so broken inside and are just looking for us to help. So for too long, much too long, mental health, and we've heard today, has been left out of discussions, and it's been left out of our capitals and cabinet tables because of the stigma, and sometimes because governments have choices, which part of the health burden do they take, and very often this gets left behind, but also in communities. And as the permanent representative said of Nigeria, it is around the world. This is a universal challenge for all of us, and so therefore the framework of the SDGs makes it even more relevant to us now that we have an opportunity to engage. I was reading some of the statistics, and they were talking about 1 in 4 of us likely to experience a mental health episode in our lifetime. And this really shouldn't be the norm. As we launched the strategy for mental health amongst the UN staff, and I supported by going to a workshop the other day, and it was about stress management. And I think within the first 10 minutes, I had to own up I was probably the most stressed person in the room. But on a very serious note, for me, the fact that that room, 90% of that room was young people, young staff, and 90% of it was women. And it said 2 things to us, that really the stress for a young person joining the UN, at this stage, we need to do something about it. But when I looked at the 90% of women, I thought, well, how many men are not here? Because perhaps it's not the thing to do as a man to come and to wear your heart on your sleeve and to open up about some of the issues that you actually face at work. So that was, for me, a big eye-opener, and one that puts more urgency for us to, shine a light on this issue and do something about it. So the tide is shifting, and mental health is becoming much more visible and a piece of what we do every day. We hope that we can share even more. I think what we really want to see are results and that whole shift across everywhere. The paintings and photos that are featured in this project remind us that today's rising levels of crisis and conflict will leave scars, and often they will be invisible for years and years to come. Increased levels of depression, anxiety, post-traumatic stress disorders, all associated with conflict, stand to perpetuate society's instability and the cycles of conflict. And so it's not just about the day after reintegration or building new schools, homes and villages, but how do you rebuild a mind that is so broken? How do we actually help to heal those minds and to make them truly a part of our society again? And the numbers are enormous. And for each one, I think, we have to remember that extends to a family. It's not just about the person, it's about everything and person around them. So it is central to the Secretary General's peace and security agenda. It's why the work of UNFPA and the Neem Foundation are so important in countries like Nigeria, in South Sudan, in DRC, many of the places where this is the unspoken crisis, I believe, that we have to take as we look for peace. Young people are going to be a crucial piece of the equation, and as they are peace builders, are change makers, we also have to remember they're survivors, once upon a time victims, but survivors, and they have strong, healthy aspirations, and we need to make sure that they are part of trying to address this challenge. Again, the statistics, 1 in 5 of our youth experience a major health episode. That's just one too many of 5, and we need to bring a 0 to that. So working young people into the mental health strategy and the youth strategy that was launched last month at the GA is important. Now we need to operationalize it. We really need to take that into our country teams, socialize that amongst our government colleagues and the private sector partners that we have, so that we can take a human response to this. Our commitment, of course, as you see, anything that you've got to do or say about mental health, count us in. We will be here. We'll lend our voice, our muscle to it. As I said, the SDGs provide a really great framework for this, and I hope that this will encourage us to speak more, to show more about this, and to invest more in mental health as a part of our universal health care coverage. So thank you very much.
Thank you. Thank you for your powerful remarks. So now we're getting to the meat of the event. I would like to now introduce our audience to the second part of this, and we have a panel discussion, dynamic panel discussion, if I may add. Please join me in welcoming to the stage Assistant Secretary General, Ms. Martha Helena Lopez, UNFPA representative, Mr. Ramanathan Blaxkrishnan, and last but not least, the founding member of NIM, Mr. Ashraf Kabir Usman. Thank you very much for joining us. Do you have a mic? You all have a mic? Just to make sure this, but you have a mic, right? Sure. All right. So I'm actually going to start with you, ASG. As we've just heard from the DSG, UN itself launched its own mental health strategy. Could you tell us a little bit more about why that was deemed necessary and also what you hope to achieve with it?
Okay, so good evening to everyone, and I'm delighted to be here in order to support this important initiative, but also an important movement also within the UN Secretariat and the whole UN system. So first of all, the strategy is a UN system strategy. It involves different disciplines within the UN system, be it the medical field, be it the security field, be it human resources. So it is a joint effort of everyone in order to tackle an issue that is important for us. And we truly believe that not only we need to take care of our physical health, but also of our mental health. Some of us do have staff members with us or personnel with us, working with us with issues that they do not come forward. Some of our workforce have family that are also going through the same situations going forward. So we do need to support and create an environment that is free from stigma. And I'll just give you a bit of a background. 20 years ago, I was younger, and I was in another drive, and that was HIV/AIDS. And I tell you that the beginning, the supporters were not there. It was really pure voluntary work, but perseverance and passion for the long road. That was 20 years ago. Today we are starting another long journey. But with the passion and perseverance and collective effort, we will get there.
Might I ask a follow-up question on that? Because I think what we're hearing tonight is action, action, action. We just got to get started. Are there any components that you want to share in terms of how you're going to roll this strategy?
The first component is going to be a reduction of stigma, and that is going to be our first priority going forward. And that is going to take a bit of help of everyone in every sense, starting for our managers and even ourselves. Sometimes if you go on the plane, they tell you to put an oxygen mask before you can help others. So we, the leaders, also have to reflect that we have to put our oxygen masks first before we can help the others. So it's a long journey.
Yeah, well, thank you very much. I'm going to turn over to UNFPA. We saw the moving video from Nigeria, and that's a very small component of your work. Could you tell us a little bit more about what you are doing in conflict areas?
Thank you so much. My name is Rama Balakrishnan, and till September 30th, I was the UNFPA representative in Iraq, where we set up and implemented the largest UNFPA program globally on sexual and gender-based violence, including sexual violence in conflict. I'm going to give a bit of my understanding from the field experience in Iraq. I mean, globally, mental health and psychosocial counseling support needs are increasing in an unprecedented manner. And this increases more in humanitarian context. and Iraq is no stranger to this trend. In Iraq, at least, one can say that there are clear linkages between the increased demand for mental health and psychosocial support needs and the volume of violence that particularly women and children went through. And I'm particularly talking about including sexual and gender-based violence that happened there. As many of us know, the war, the ISIS terror in Iraq is over. But for at least for tens of thousands of women, the long road to recovery and the long journey to recovery is just starting. It's just starting. So looking at the UNFPA's program in Iraq, where we operate more than 125 women safe spaces, I would like to highlight the issue from two sides, the supply and the demand. Let's go to the supply side first. Capacity of providing mental health and psychosocial support services in many countries is limited, and is often limited to psychiatrists and medical professionals, psychologists providing services to a chronic section of the population. So if you're looking at, to be fair to Iraq and to any other country in a conflict setting, if you're looking at a country which has suddenly entered a conflict situation and a prolonged conflict for 5 years, definitely you're not going to find the capacity there to deal with the mental health and psychosocial support needs. The case is the same in Iraq. So that's the capacity side. So during humanitarian settings, there is a heavy dependence upon external service providers to provide that service to women and children, which is what UNFPA has been doing, but with a key understanding that in the transition period, this capacity has been transferred to the government because they are the long-term service providers and they will be the ones who will be journeying their citizens in this long road to recovery. Now, let's look at the demand side. I mean, health is one area where you also have to work on the demand as much as the supply, and mental health even more so. We are looking at, if you're looking at women who have basically suffered from sexual and gender-based violence, including sexual violence, then we are looking at a very close group of women in a very traditional context. And therefore, there's a lot of work that needs to be done before there is an acceptance of the demand side from the survivors themselves. So that's what UNFPA does through its Women's Support Service Centers. The last point that I would like to add before I close is that while we work on the supply and the demand, we should also be very mindful and we should be very careful and we should seek out those people who can make these connections probably better than we can do as UN. And the example that I would give is in Iraq, when you had the Yazidi issue, the fatwa released by the Yazidi group of elders in destigmatizing the access of treatment by Yazidi women and girls was a significant milestone in ensuring that women were able to access the services without stigma. So I would stop there. Thank you.
Okay. Well, thank you very much. And again, I think really important to hear about the sort of key lessons that you have learned out of this exercise. I'm going to turn over to Nim now. Thank you for joining us all the way from Nigeria, by the way. Could you maybe start by telling us a little bit about what your organization does? Yeah.
Thank you, Elizabeth. And may I start by extending thanks to the Mission of Qatar for organizing this, together with, of course, the Mission of Nigeria and the Office of the Deputy Secretary General. And thank you for giving us the platform to discuss something that's of significant importance, of course, something that's central to what I do and central to what my foundation does. I work for an organization called Neem Foundation. And at Neem Foundation, we're into the work of preventing and countering violent extremism and peace building. And all of our approaches are underpinned by an element of psychological support and mental health and treating mental health. And we have a wide array of services in terms of rehabilitation and counseling work, and it's all underpinned by psychology. And we do this because we believe that wide scale we have an understated value of psychological support when it comes to holistically providing solutions in conflict resolution. And within the population that we work in, we have an underserved population when it comes to mental health. So for example, I'll just give you one stat. I don't want to reel out too many stats. But as you can imagine, anyone familiar with Nigeria knows we've had tens of thousands of deaths in the last few years. We have millions of displaced people. So you can imagine the amount of post-traumatic stress disorder, you can imagine the amount of severe depression within that population, within the northeast of Nigeria. However, 90% of people suffering from mental health issues don't ever get treated. 90%. And we have roughly 190 million Nigerians. So this is a very, very important topic for us. One of the things us policymakers historically and humanitarians we've been guilty of is assuming two things. We assume that psychological support and mental health when it comes to conflict is transient. We believe that it will pass or time will heal. The second assumption is that it's sufficient. So historically, we've assumed this. However, research has shown when you look at the Nazi Holocaust, when you look at the Japanese concentration camps, mental health is not transient in victims. It showed actually that 40, 50 years after the tragedy has occurred, mental health is still amiss in those victims. People still suffer from post-traumatic stress disorder 40, 50 years later. In fact, worse than that, what we've seen is that post-traumatic stress disorder and depression can be passed from generation to generation. Now, when you contextualize that to Nigeria, and when you look at the pathways to radicalization that we found within Nigeria, neglect and perceived injustice was a huge factor. Now, allowing mental health to go unaddressed in conflict situations clearly is not very good. You find that in Nigeria, our capacities are particularly low. Another statistic is that we have roughly one psychologist to 1.3 million Nigerians. When Neem Foundation first started in the Northeast, we were responsible for half the mental health and psychological expertise within Borno State. That's the epicenter of the insurgency. So we're lucky enough to be led by a world-renowned psychologist named Dr. Fatima Akilu, and we kind of got a head start when it came to programming and bringing in psychologists. And our pioneer program was a program called Counseling on Wheels, and we're very proud of this program. In the first year, we saw 8,000 people, and what we did was simple. We bought tricycles, we engaged psychologists, and we trained lay counselors robustly for 9 months. And this allowed us to widen the access to trauma care and to address psychological needs within the nooks and crannies of Borno State in areas that would not really receive that kind of attention.
In fact, I was just going to ask you, I think you started to touch upon that in terms of the challenges, because I was indeed looking at your website, and I know that you you were able to provide counseling for about 7,000 people in Borno State. What would be some of the specific challenges that you have as a foundation?
Yeah, so the main challenge as a foundation is the expertise. No matter how much we've trained counselors, there's still a dearth and a skills gap in terms of capacity. That's the main thing. We've tried to address that by introducing a training center in which we're trying to train first-line responders in terms of police and other healthcare workers. We're trying to train when it comes to working with local government institutions in terms of reconciliation. We're trying to train their capacities in terms of responding to trauma at their own level. So we're trying to decentralize the capacity to respond to trauma, because that's the way we can reach the most amount of people. So that's one challenge. The other challenge is, of course, as it is globally, is stigma. Yes. That program that I referred to, of course, men, I think only 13% within that 7,000, 13% were men. In the second year, we're doing a little bit better as awareness comes along within those communities. We're approaching 20%. But of course, stigma is still a huge issue there.
Yeah. Well, thank you very much. I think we're coming to the end of our program, but I want to end on an action note. So all the panelists, very quickly, what is the one thing, one action that you'd like people in this room today to take away? Any thoughts? What can we all do?
Okay. Okay, I'll start.
Okay. Just one quick action point.
Okay, one quick action point
Yeah.
is when it comes to mental health, it doesn't need to be pure mental health service provision to address mental health issues. You can incorporate mental health across different conflict resolution programs. You can incorporate it when it comes to reconciliation and truth, which is the phase that we're in Nigeria now. You can incorporate it into education in terms of providing coping mechanisms for young children. You incorporate it into so many things. So it's to internalize the idea that mental health can be widespread and decentralize that kind of capacity.
And can mainstream it in the SDGs. Okay, UNFPA, any thoughts?
Quick thing, I'm going to borrow the words used by the DSG, the choiceless choice. We really need governments, particularly donor governments, to focus on mental health and psychosocial support needs in humanitarian conditions, not just the roads and the hospitals and the buildings, but we really need we need additional resources to address these invisible wounds, which are much more dangerous than visible wounds. Thank you.
Thank you. ASG, you have the final word.
I have the final word. I think we can do it together. No one can do it separately. It's a collective, global effort from every corner of the world. Thank you.
Thank you, panelists, and please a round of applause for our panel members. So I don't believe there are any closing remarks. So I think just to say thank you very much for everyone for coming. Thank you to our sponsors and our collaborators. There are drinks and food, so mingle, go and see the art, and thank you very much and have a good night.